Thanks for tuning in to Veterans Voices. I am your host, Joshua Zebley, and my co-host is Elena Kim. Joining me in the studio is Buck Carmichael. Today we'll be talking about a difficult subject, suicide prevention for women veterans. If you want to be part of the conversation or you have any questions, just use the QR code on your screen to join us in Zoom webinar. We are aware that these conversations can be triggering, so we'll be showing the number for the Veteran Crisis Line during the show. If you start to have difficult feelings, please call. Our guests today are Deborah Taylor, Suicide Prevention Community Engagement and Partnership Coordinator for the VA in Northern California, and Brianna Belcher, Suicide Prevention Coordinator, also for the VA. Thank you all, and welcome to the show. So women veterans, from what we've heard over the last few months from a big report that came out, are twice as likely to commit suicide or to attempt to commit suicide compared to male veterans, and they face a much higher rate of PTSD, post-traumatic stress and depression, post-traumatic stress disorder and depression. And when I saw that a few months ago, I was like, this is something that we need to really discuss and kind of get to the bottom of it and figure out how we can help these women veterans. So, again, thank you all for being to the show. So how is suicide and suicide prevention unique for women and women veterans? If you could start, Deborah, that'd be great.
Sure. So female veterans, as we know, are not the majority in the population. So they're the minority in the veterans or in the military. When they discharge, they're not a huge population. So unfortunately, there aren't a lot of resources for them. And that has been one of the biggest issues, is the resources upon discharge. A female veteran can serve in the military for 10, 15 years and then discharge, become a veteran, and then want to start a family. And unfortunately, those are services that just are not available everywhere for female veterans. And we've also realized that the newest issue that they're facing is homelessness. And that's just a big issue that we're trying to address and find areas that we can provide those types of resources, as well as housing that's just for female veterans.
Thanks, Deborah. And so you're talking about one of the differences being that there's just a lower amount of resources out there generally for women who are either experiencing suicidal ideation or just trying to navigate life after the military. And that's such a great point that you're making. And to Josh's point earlier, we're talking about suicide prevention today, so there's a lot that's going to come up. Some other things that might come up, though, is things like military sexual trauma. So I just also wanted to warn our viewers at home that these conversations might touch on that too. Bree, I want to go back to Josh's question and ask you, a part of it that we didn't cover is how is Deborah talked about suicide prevention being a little different for women veterans. How does the actual experience of suicidal attempts or suicidal ideations, do you think there's a difference there between women veterans and male veterans?
I do. It seems like males use firearms more often. Just being a suicide prevention coordinator, when we ask them, do they have a suicidal plan or attempts, it seems that firearms are the more aggressive way to attempt, compared to women. They might do like overdose or cutting themselves as well. But also, to speak what Deborah has said about it's been a male-dominant environment, I think a lot of people are afraid to report as well. So it's also underreported too for like MST. And there's a hierarchy and power imbalances within that as well too.
Yeah, I've heard that. So thank you for making that point.
And just to open it up to the panel, are there unique challenges that female veterans face during like a reintegration into civilian life from military that might impact their mental and physical health?
Absolutely. I worked with a female veteran that was in the Army. She had been in for 18 years. She discharged with an honorable discharge. And I remember meeting with her and her saying, I just don't know even how to get dressed in the morning. And I thought to me, like, whoa, I thought you would be excited to not have to wear a uniform. And she said, no. And she started with her depression after she discharged because of that. So leaving the military sounds, that it wouldn't cause depression, but it does, because they're so used to that pattern, that lifestyle, and being told, what to wear. So that was really eye-opening for me, this female veteran. We ended up working with her for quite a few months, and got her connected with a therapist, but that was really surprising, that just not knowing what to wear after being in the military for so long was one of her triggers. It just really caused her a lot of issues and depression.
I love that you sort of caught yourself on that assumption, Deborah, and are learning from that, because I think there's a lot of assumptions about women veterans, and you just saying like, oh, I thought you'd be excited about like what to wear. And I think one of the things we forget is, like male veterans, women go into the military very young, right? These are teenagers sometimes, and so they haven't really developed a lot of life skills outside of the military. And when they're in the military, when we're in the military, because I'm an Army veteran, we want to do the best, and we want to conform, and we want to meet standards and exceed standards. And so at that point in our life where we are really building out who we are, we orient everything that we have in ourselves towards the military. And so it just becomes this really core part of who we are. And we're not having some of those same experiences that other women might have in their, late teenage years or early 20s, in the same way that civilian women are having those experiences. But yet when we get out of the military, we don't look like male veterans, right? We don't always have those indicators of like, a sleeve full of tattoos, or a high and tight, or, wearing a lot of the military clothing. So there are these assumptions that, oh, you're just like any other civilian woman. And it's great, especially when providers can catch themselves and say, well, this makes sense that you wouldn't, know exactly how, to dress, or exactly how to do your hair, or how to conform to civilian standards right away. And let's see how we can work with you on those. Something as basic as that, I think, could really be beneficial in helping someone through depression or anxiety. Another thing I was going to bring out to this point, though, is what about misdiagnosis, right? So we talk about the challenges that are unique to women veterans. I've heard anecdotally that I came out, I talked to my provider, and they said I didn't have PTSD, or I couldn't have PTSD, right? That's something that only, a male veteran would have. Do you guys have any stories on that?
I don't know, Bree, if you want to speak to that, but I do know that I've met with female veterans who've had that same issue. And it's interesting because they will try to rationalize, well, why is it clear in the male veteran, but in mine, it seems like they can't, find it, and that goes back to just women are different than men. I mean, it's just, that is the reality. And so trying to categorize them like male veterans is not working. And I feel like because there's such a minority in the military, that issue really hasn't been addressed, but I'm hoping in the future that it will.
I would like to add too, one of the challenges that I've seen when people call into the crisis line, they ask for a referral for mental health. And mental health is a predominantly female field, but they want somebody specifically that's a veteran, that's also a therapist, which is very hard. I actually don't know any that works at my VA that's also a therapist as well. So when I recommend to veterans is to maybe like join group therapy. Group therapy is very great because you get to be around your peers and you know that you're not the only person that's been going through it. And there are some like all female groups as well too. And then even though a clinician does not run the other ones, it's some that's like on Facebook. A lot of veterans love the Facebook groups. They'll meet at their local Starbucks and talk about things that they've been through and just be able to vent and get some understanding. And then also about the PTSD symptoms different in women. Not every clinician is for you as well. So veterans are able to switch therapists if they want to. And I always tell them that, like, if you feel like you're not having a good bonding experience with your therapist or they're not listening to you, then you can request to see somebody else too. So just be an advocate for themselves as well.
Those are such excellent points, Bree, and we're definitely going to expand on some of those in our final segment today when we talk about what veterans should know, right, when they're facing this. Really quick, we got a comment on Facebook. Jennifer Barnes Alvarado says there's around 600,000 female veterans compared to 7 million male counterparts. Many of us also live in rural areas where there is an issue with access to care, and we also need to get the Veterans Affairs, the VA, to add flags in their algorithm that suit women veterans. I'm not sure if we're talking about like physical flags there or sort of knowledge of things to stay aware of that women are facing. But thank you for that comment, Jennifer. Any thoughts on that comment, Deborah or Bree?
Yes, there is an issue with rural communities. There's not a lot of veterans would like to go face to face with their therapist, and it's just not in their area. So another thing would be the VVC calls, where they will be able to do via Zoom. And then if you don't have the electronic device too, we can put you in a referral as well, so you can get one of the iPads that's issued by the VA, so you can do your scheduled appointments. A lot of our patients who are rural area does that option as well.
Thank you for the Facebook comment, Jennifer. We really appreciate it, and we're happy that people are engaging in this conversation and speaking to, we have Elena, a female Army veteran, and we have 2 therapists here as well. So we have a lot of experience just on this call. If anyone out there is watching and they want to engage, please use the Facebook or however you can engage. We would definitely appreciate it, and we'll do our very best to get to you. I want to expand a little bit on military sexual trauma. So that's I'm just interested, and I think we all are, Brianna, especially in your line of work. You're getting calls, female veterans, male veterans. What's the roles at MST? Or I'm not quite asking for the percentage, but I really am asking for, like, are the majority of them MST, or are they something else? So that's
I wouldn't say majority is MST. Also, so since it's the suicide hotline, they've already talked to one person before, and then they talk to me after. And a lot of veterans get tired of telling their story over and over again. So sometimes they don't disclose all the information to me because they would rather it be their actual therapist. So when they do, it's just like a brief overview, so I can put in a referral to give the therapist a heads up. But a lot of them are having symptoms of PTSD just generally. I haven't had too many with actual MST per se.
Yeah, and on the MST point, I'll add, so defining MST, right, military sexual trauma. I think there is an assumption that when we talk about MST, it does always have to do with a physical assault, and that's just not the case, right? Sometimes MST could be an exposure day in and day out to sexual harassment. And so a woman veteran might not immediately relate to the terminology of military sexual trauma because they believe, well, I didn't experience this egregious physical assault. Therefore, when people are talking about MST, they're not talking about me. When in reality, it does take that veteran to come into the VA and talk to someone and really learn about the terminology and the definitions before they get to the point where they even identify with some type of diagnosis or some type of experience. So I just wanted to add that. Deborah, I see you nodding as well. I just wanted to add, we have another comment on Facebook from Lisa, and she asks, this might be a question for you, Bree, but feel free to jump in, Deborah. Can more women veterans be hired for suicide prevention lines? Where would those jobs be listed? And Bree, maybe you can talk about, some of the qualifications for that.
Yeah, so USA Jobs would be the main place to go. There are actually, you can filter where some positions are only hiring veterans specifically, and the civilians cannot even apply for it, but veterans do have priority at the VA with getting positions. For me specifically, I think when I started, the role was a GS-12. So it would, if you had like experience and things of that sort, then you would just apply that way. But yes, it's high priority to hire veterans.
We were going to talk about the suicide prevention hotline in the third segment, but I think we need to talk about it a little bit more now. So tell us a little bit more about it. It's 24 hours, 988, press 1. Anything more than that? I mean, who are you going to talk to? How do they get to you?
Yes. So you also can text as well, and third parties can call 988 as well if they're concerned about a veteran too. But there's initial persons like the triage team. They will assess your situation. If you are at risk at that exact moment, they will like try to talk you down, talk about coping skills with you, safety plan, emergency contacts, and things of that sort. And then if needed, they will let you know that that welfare check will be done by the police. Or if you need an escort, like via ambulance because you self-harmed or something like that, they will also call that for you. So how they get to me is I'm the person after that. So if they are in immediate danger, it ends there because they get the resources and things that they need. But if you're like having another type of mental health crisis or you've been chronically suicidal like your whole entire life, so it's not like an immediate danger, then I'll follow up with you. Once we get the call in our database, we have 24 hours to contact you. I'll do like a short suicide assessment with you, depending on how you answer the questions. It might be a longer assessment, and then we'll also do a safety plan with you. And then the last step is providing you with additional resources, whether you want a referral for community mental health or the VA, or even like our homeless vets actually are in crisis as well too. So I will refer you to HUD-VASH and give them a little bit more about your information too.
Thank you. I think that sets the stage for, this is the most important service, to be able to 24-hour access to somebody at any moment, wherever you're at. And you did mention that, some female veterans want to speak to females only. They want to speak to female veterans only. They don't care if they're a veteran. Is that an opportunity, or is there that option when you join on and you automatically hear a male voice and you're like, no? Can they route you to a female or have them call you back?
Yeah, we will try our best to do that. Like my team right now is like pretty diverse. It's like 50% female, 50% male. But again, we are humans. So sometimes, people have off days and stuff. So if not, I will just, like if somebody said they wanted to talk to a male, I will let them know that a male isn't available at this time. But if you do want a follow-up, I can do that for you. Or if you want a referral for mental health, I'll put in the comments and put like stars near it that the veteran is requesting a male provider or a female provider only. And then they will actually honor that for sure.
Thank you. And Deborah, can you tell us all why suicide prevention is so important to you?
Well, it is very important to me. I know a veteran that I worked with many, many years ago, and I thought that he had gotten to a place where he was stable, and unfortunately he wasn't. And so that was like, 12, 13 years ago. And it's just always affected me, and that these are veterans that have served and gotten our freedom, and yet they're coming back and dying by their own hand. And so it's just a big place in my heart for veterans, and the lack of resources is clear, and we just really need to get more resources for these veterans, especially in the rural areas.
Thank you. I'm glad that we have, both of you with so much passion, and us included, Buck, Elena, we're all in the veteran, but you guys take it an extra step and deal with everyone who comes to you is in a crisis. So it takes a certain personality to be able to do that. Thank you so much. We're taking a brief break, but when we come back, we will continue our conversation. Stay with us.
We all make more than 35,000 decisions a day. Most are small, but some can be life-changing.
When it comes to taking care of yourself, the most important choices can be hard to make. Like having a tough conversation instead of ignoring a buddy's call.
Or being there for support, not assuming things will just get better.
Or fighting through challenges rather than giving up.
And while we all face thousands of choices every day, there's one that can make all the difference. Today, make the decision to be there. For the veterans in your life, for your community, for yourself. Learn more at BeThereForVeterans.com.
Welcome back to Veterans Voices. We're talking about suicide prevention for women veterans. So thank you all for joining us again. And I think this section is one of the most important sections that we can really talk about. It's really how to identify, how family, friends, coworkers can identify that a veteran that you're in close contact with, close communication, is experiencing some mental health issues and perhaps having suicidal ideations. So let's talk about that. We'll go with Deborah. What are the first steps for friends and family members who notice a veteran is having these thoughts?
So if you're noticing signs, and we do the VA SAVE, which the S is for know the signs, the next step is you want to ask that question and be very direct. Veterans appreciate directness. They appreciate, being very clear with where your direction is. So asking them that question, are you having thoughts of wanting to harm yourself? People think that's going to create more suicidal thoughts in their mind. It's not, but that is definitely the question that needs to be asked if you think there are signs that you're seeing in a person.
I like that, taking it head on. Go ahead, Bree.
I would like to add that also preparing for the conversation. I think that people should do it in like a quiet, private space. Also avoid like trying to diagnose them yourself. Like you have PTSD, don't you? Like, don't do that. Or trying to minimize their feelings, like it could have been worse, like you don't know what they've been through. And then also, I think people need to expect resistance and stay calm. A lot of veterans feel like they might appear weak or burdening others and losing control of their emotions, but you should be responding like, I get that it's hard to talk about this. You don't have to say anything today, but I'm just here for you, and just letting them know that they're there, whether they want to talk today, tomorrow, or next week.
Yeah, those are really good tips. And, it's interesting because, Deborah, you work in the field of educating the community on how to spot these signs and how to talk to veterans who are experiencing suicidal ideation. We've actually got a comment from Jennifer on Facebook, and she's asking, what about funds that are already allocated for veterans' suicide? I'm assuming we're talking about, specifically within the VA. How are those funds being spent? And I think, earlier we were talking about the Staff Sergeant Fox VA suicide prevention grant. So this, Jennifer, this is a grant that the VA gives out to community providers, recognizing that not every veteran wants to come into the VA, right? And some veterans might be better served by a member of their community. And so the VA will give out these grants to local community providers in the hopes that, no one's falling through the cracks. Even if you're not getting to the VA, which we hope you do, maybe you're getting to a community provider and maybe they could have those conversations about you. And Deborah, you do a little bit of training with these community providers. Can you talk a bit about that?
Yeah, so in my role, I do the VA SAVE as well as the VA lethal means training safety. And the SAVE is really easy. Like I was saying, it's just know the signs, you're going to ask the questions. V is for validate the experience. And then E is encourage the veteran to seek treatment or expedite treatment. And so those are the things that I do educate the community partners with. And I'm also like a link. So if they do have, let's say there is a veteran in the community and all of a sudden they decide they want to be linked to the VA, they can reach out to me, and I can also do the referrals like Bree does.
I would like to also add, we always talk about signs. So just to list a few that's typical, not limited to, but isolation from family and friends, away from their normal activities, extreme anger, irritability, mood swings, increased substance use, including alcohol, trouble sleeping like insomnia or nightmares, hypervigilance or being easily startled, talking about hopelessness, helplessness, or feeling like a burden. And even some veterans talk about death or suicide in a joking way. That's also like a sign as well.
And thank you for listing some of the signs, because that was the next thing I was going to ask you. So we talked about, you mentioned that it's okay to ask. That's not going to you're not going to put the idea in their head. No one does that, right? I mean, you need to ask people stuff directly if it's something very serious like this. Oftentimes when we're asked things, whether we're feeling good or bad, or, we all remember when our parents said, how was school? We said, fine. Is that inappropriate? And we know you're not fine. What do we do then? How can we, break that down to the next level of, I can see that you're not, I don't know how to say it. I can say that you're not fine. I can see that you're not fine. Is that okay? Or what do we do?
I would say yes. Using I statements is great. I see that you're not doing well, or I care about you, this, so they can understand that you're not coming to them in a judgmental way and you're just really concerned. So yeah, being straightforward and asking the hard questions like, are you thinking about hurting yourself? Or are you thinking about killing yourself? Like, that does not increase risk at all.
Very good to know. We got another comment. I love all the comments coming in from Facebook. Drina Ross just saying she's watching us from Detroit, Michigan. So hello, Drina. We're very, very grateful to have folks across the nation tuning in today to this really important conversation. Deborah, what are some of the common barriers to helping veterans and maybe specifically women veterans? Because that's what we're talking about on this show. And how do we overcome those barriers?
I think the first barrier is, well, there's two I see as the main. One, they don't want to seek treatment with the VA. And, we understand that. So the VA is not trying to drag them back to the VA. We get that. So we finally have stopped doing that. So now we're educating the community. And then the second one is just lack of resources. And like I was mentioning to a colleague of mine, the vet center, for example, up here in Chico, they don't have one in Reading or these other areas. So there's just one vet center. They have no female veteran counselors, so the female vets don't really want to go there. So it's really a lack of services. And then also just the female maybe that military sexual trauma or whatever she experienced in the military is put a fear in her to even seek treatment. So those are the two main barriers, just the veteran themselves being resistant or fearful to seek treatment with the VA, and then the VA not having enough services or resources, which we are really trying to work on, but that is the reality.
And just a follow up to that question. So I'm talking to a friend or family member who's a veteran, and she is expressing these barriers to me. What do I say to her to help her overcome that when she says, I don't really want to go in because, they don't have enough women providers for me to talk to? What are some of the things that we would say in response to that?
Well, I think like what Bree had mentioned, there's a lot of other services out there that are not VA. There's a lot on Facebook. There's a lot of virtual groups. I know a woman up here, she's in a group that has people down in Las Vegas, which I thought was really great. So there are some groups that are outside of the VA that have been created by female veterans and other outside agencies. So definitely there are services out there, kind of have to look a little hard sometimes. One of my roles, though, is to give those resources. So if a female veteran is, saying I need these resources, they should reach out to their VSO or to one of their community partners like me. So yeah, I don't know if Bree, if you have anything you want to add to that, but
yes, I would like to just add one thing. So a lot of people forget too, it's been a saving grace for a lot of veterans who are employed, is EAP at your employer. It's a free resource. A lot of jobs have offered that. It is more like condensed though, like they only approve for a certain amount of weeks, but in between time, how Deborah was saying, like there's not enough of mental health staff at the actual VA. So if you're like waiting to get an appointment, your appointment is like 2 months out or something. In the meantime, you could be talking to a counselor within your employer as well.
Yeah, EAP, the acronym is Employee Assistance Program. And basically what you're saying, Brianna, is that if you have a civilian job, you're not even in the military anymore, check in with your HR department and ask them if they have an employee assistance program. And typically what that means is that the employer will pay for, 6 to 12 sessions with a therapist in your community and get you the help that you need. I'll add that Lisa on Facebook says, please help get the information out that Army Family Life Chaplains serve all ID card holders and their family members of all branches of the military as long as they have base access. So that's definitely another resource. Josh, did you have something in the studio?
Actually, I do. Deborah, for you, what role does the character of discharge for the veteran play in their ability to access this mental health care through the VA or to have access to a suicide prevention coordinator?
So the VA, there are those criteria that you need to be enrolled in the VA to get services, but we do have the Compact Act. So that's for veterans that are not enrolled in the VA but have had a suicide attempt. The VA provides all the coverage, even treatment, therapy for that member. So there is like an option if you're not enrolled in the VA that the VA will still provide that treatment, but it is based on a crisis like a suicide attempt. And then through the VA, we do have our own referral systems to get, therapists and treatment like that. And I hope I answered that question. I think I
And I will
stream.
say, veterans who call in, even if they're not enrolled, they still get assistance at that time. So you call 988 and you're suicidal, we're not going to be like, oh, well, I don't know who you are, bye. We're going to actually help you and assess you, and you even will make it to the suicide prevention coordinator. And if you don't have a chart, then I can refer them to like VBA to get enrolled and listed, so I can put in a referral for you. And then if not, I'll ask you what's your zip code, so I can find you a community mental health provider in your area as well and provide you with those resources.
Great.
I had a question in terms of like unique barriers, and curious to know if you guys have heard or experienced this with some of your clients. I think one unique barrier to women seeking care is that most of the time women are primary caretakers for family members, especially young ones, you know, and they might have a fear that if I reach out and say that I am experiencing suicidal ideation, what will happen to my kids, right? Is that a fear that you've heard of, experienced, and what is the feedback that you'd give someone who has that very, very scary thought?
I have experienced that on a call before. She wanted to actually go inpatient to help with her suicidal ideations. So we were just like trying to come up with resources for her. Like, you know, do you have any external support that could potentially like watch your children, like grandparents or friends that you actually trust? So she happened to have those resources, and we were able to schedule that for her. But just because you're going inpatient for mental health issues doesn't necessarily mean someone's going to call CPS on you, as long as you're like not leaving the children like unattended at the house for a week or so while you're in the hospital per se.
So in this portion of the show, I really want to focus on indicators for family and friends they'll see. So you did mention family, friends, they can call 988 and talk about their veteran, but to find those signs, is the best to go on the VA website? Is there a list somewhere where they could say, you know, I really need to research this a little bit more? Where would you direct them to? That they're not ready to call in, but they just need some type of education on what these potential signs could be.
So I can speak to that from my role in different so I cover about 10 counties. In each of my counties, we try to come up with a resource. So for example, in Glenn County and Shasta County, we do have QR codes. So members can scan that code. It takes them to a website that has all the resources. It even has like a VA link if you need, you know, VA resources. And so that is one way that some of my counties are getting like the information out and trying to connect with people, is through those QR codes.
Thank you.
And I'll add to that, Josh, because you're asking about like indicators, and we're talking about women veterans, right? Mm-hmm. I think that it could be more challenging to see the indicators in women veterans. We are skilled at adapting and blending into our environment. That's what we learned in the military. That's what we were taught. And we're always taught to put our best face forward. So it could be challenging to spot the signs. Another part of that is what we talked about earlier, is just as human beings, we have assumptions about what things look like and what things don't look like. And when we look at a women veteran, we might, you know, have a bias that tells us like, oh, I'm sure she's fine. I'm sure she's taken care of. So I would encourage family members and friends, if you know a woman who has served, check in, right? And just stay in touch, and don't make an assumption that because they're not saying everything is fine.
Yeah, I 100% agree with the check-in. I can't obviously speak as a woman veteran, but I've been out of the Marines for 20 years, and I'm still, having one-off conversations with 10, 20 different veterans, and I encourage all veterans and women veterans, because today's the content, to just send if you're sitting on the couch, send somebody you haven't talked to a text message. That in the movies, they show that that's life-saving. I think it is probably pretty accurate. If somebody's thinking about you, somebody cares about you, somebody wants to make sure that you're okay, and that could open a conversation. So I'm hearing all of our, the comments that are coming on Facebook and Zoom. Please, text a friend, say, watch this episode, or tell them how are you? Are you okay? What's up? Set a reminder on your phone for their birthday. Anything I think is very helpful as people and as veterans. So definitely want to encourage that.
Well, in the first segment, you also had mentioned the peer support groups and the women's only groups that are allowed. What role do you see those playing in a woman veteran, maintaining their mental health after service? A lot of other organizations, they're oftentimes related to men in a lot of things. VFW, American Legion, the roles there, a lot of the members are males. So what role do those peer groups play for females when they do get out of the military?
I think the groups allow them to know that they're not alone and that somebody else has experienced this thing as well as them. So they share stories or share what works for them, whether it's different treatment modalities or different things that they do with coping skills. And group just brings that out because I think a lot of veterans who ask for female therapists who was in the military, that's what they're looking for. Somebody that can relate to them and actually understand and not just empathize with them. So I think a group allows that safe environment for them. And it's like a judgment-free zone because we've all been through the same things.
Such a good point, Bray.
So
I have to say, there is such camaraderie with the veterans. And even though I worked for the VA for 10 years, it's just so powerful when it's a veteran that's, coming forward and being like a social worker instead of just me as the social worker. So yeah, that's really great.
These programs, you all mentioned that some female veterans, they don't want to go into the VA because they don't want to appear weak. Some people don't want to go to the VA for that reason anyway. But from our side, a VSO or a community provider, the more numbers that we have, the better the benefits are going to become. We have veterans that come to us all the time and say, I don't want to apply for this because I feel like I'm taken away from another veteran or anything. So I just encourage veterans to seek that treatment, or at least get yourself counted as, and you're helping other veterans by going in there and helping yourself at the same time. If you determine that the VA services are not the ones that you want, and you find it through EAP or through your primary physician, that's totally fine. But at least now the VA has another number that can say, wow, we are really experiencing an increase in, we need an increase, we need more services for this particular group. And that's for anybody, not only women veterans, but older veterans, younger veterans, whatever it may be.
Yeah, really good point, Josh. I think just to sum it up, you're saying VA cannot provide these services if women are not showing up and asking for these services. So keep that in mind if you're a woman veteran who's sitting at home right now and saying, I don't even want to give it a shot because it's not going to work out for me. Unfortunately, you may be right. It might not be the best experience for you the first time that you walk through the door, but the more that you show up, the more that you voice your opinion, it's going to improve. And it's not just going to improve for you, it's going to improve for that woman veteran who comes after you. And that's why it's so important for you to be there.
And I will say we have a stand down in Butte County, and the female veterans up here got together about 2 years ago, and they complained. And they said, there's nothing for us female veterans, and we want our own space. And so we have redone the stand down. We now have areas for just female veterans. And there's even just talking about their benefits. They did not want to do that in front of male veterans. And so we've separated everything and really listened to them. So it did take me by surprise because they spend all this time in the military together. I thought, it would be the same after they get out, but it's not. And so I think just listening to their voices is really important. And I'm glad we made that change in our stand down up here.
Thank you. We're going to take a quick break. When we come back, we will conclude our conversation. Stay with us.
Honestly, I'm not really sure why I'm calling. It's just...
I'm having nightmares.
My husband and I, we're just fighting a lot.
I can't get any sleep.
Things just keep getting worse, and it's starting to feel like I can't do this by myself anymore.
We could use some help figuring things out.
Okay. Well, I'm glad you called. Why don't you tell me more about what's going on? There's no wrong reason to reach out for crisis support. Whatever you're going through, the Veterans Crisis Line is here to help. Visit veteranscrisisline.net to learn more.
Welcome back to Veterans Voices. We were talking about suicide prevention for women veterans. So far we've had a great conversation. We learned about the indicators that family and friends. We learned about the 988 hotline. Let's get into really the veteran. Like, what can a veteran do? What is the first step for a veteran who's having difficult thoughts or thoughts of suicide? First steps. We'll go with Deborah, please.
So if a veteran is feeling suicidal or having those thoughts, I mean, it depends kind of what, where they're going with it. So if they're just, having those thoughts and they start to feel like, okay, I really am unsafe. I mean, the first thing would be to, where are you? Are you at home? Are you with people? So finding out like that setting. So when I get a call, I always ask like, well, where are you? I've had people call me and say, I'm in the grocery store and I'm suicidal. So it's kind of hard to send, 911, but finding out like where they are, who's with them to give them any support. If they're alone, can they go somewhere? Do they have somebody that they can reach out to in that moment? But you're also always assessing their, how, if they're very close to making some kind of an action, because that's going to change and you're going to end up calling 911. Bree, do you have any follow-up?
Yeah,
I'm sure you have more.
I would say that there's also a difference. Some veterans will feel like just thoughts of wishing that I was dead or wishing that I can go to sleep and not wake up. That's different than having like a suicidal plan with action and intent on acting on it, or was in the process of it. Like if, for example, they had a knife up to their neck or like a gun or a weapon or something, then that's like more serious than I wish I could just go to sleep and not wake up. So for me, we assess all of those type of things. And then when we get further into our assessments, we talk about triggers and things. So the number one thing is to reaching out, even if they don't want to reach out to 988, reaching out to that family member or a loved one or somebody to talk about how they're feeling. And then usually after that, veterans will say, oh, well, my wife made me call you guys because such and such, or I was talking to my sister and this happened, and then they'll reach out to us. Or again, a third party can also call 988 too if they have any concerns about the veterans too.
So can you elaborate on that? I just want to make sure I heard that right, Brianna. A third party can also call 988. What does that mean? What does that scenario look like?
Yeah. So if my friend is talking to me and she's telling me she's feeling suicidal and she's been having these thoughts for a while now, but she doesn't want therapy, and she's continuously talking about feeling hopeless, I can call her as a non-veteran and give the first and last name and then her phone number. Now, sometimes they don't know the last 4 digits of the Social Security number, which is fine. As long as we get the phone number, we can follow up with the veteran and then go from there to see if they're enrolled or get them mental health resources. And then also providers can do the same too. Like you're a medical provider, if you answer like yes to like the depression screening and things, or if you say something to the receptionist or something like that and they're concerned about you, they can also call 988 so we can do the follow-up and see if we can assess you and provide you with additional resources for you.
Nice. And then we've got another comment on Facebook from Denise. She says, we need more peer support groups specifically for women veterans. I've been to a few women veterans events and it has been a saving grace. It forces me to get out of the house and not isolate. And she is writing in from the Tampa area. Denise, I feel you 100% on that one. We take for granted that a lot of these spaces, if not all of them, were created with the male veteran in mind. And there's an assumption in our society that women will just figure it out. And so when we do enter a space of women veterans or an event that was really designed for us, it can be a life-changing experience, right? It's very, very powerful. Denise also mentioned isolation, and she says, you know, these events tailored towards women veterans, they forced me to get out of the house and not isolate. Let's talk about the role of isolation in suicide and suicide prevention. Let's define isolation at first, right? So to me, this is like, you've got a group of friends or a family, and you are typically out and about, and you know, maybe regularly making phone calls or showing up to events or engaging, and then all of a sudden it changes. What's going on in this scenario, Bree or Deborah?
Sometimes, oh, sorry, you can go, Deborah.
Well, definitely. I mean, the veteran is, when they isolate, that's a big clue that something's going on, something's changed for them. And, you know, a lot of times it's so overwhelming, everything that's going on with them, that they just would rather isolate, and they could become kind of frozen. Like, I'm just going to stay in here. And even though we know that's not going to help them, they just get so trapped in it's like you know, that's that slippery slope. You know, once you start to slide down it, it's really hard to climb back out. And so that's part of that isolation. And also that hides, you know, what they're really maybe feeling. They don't want to get that out. So they don't have, if they isolate, they don't have to hide it all the time. They can just, you know, be in their own space.
Mm-hmm. Go ahead, Bree.
I was going to say the same thing about the hiding their feelings. It's just easier. Like, if you're not talking to family or friends and going to work and things, no one can tell that something's actually wrong with you. So it's just easier to like stay to myself.
Such a good point. Yeah.
For Deborah or Bree, could you help us just communicate this message with all veterans and women veterans, that it's okay to have these thoughts and these feelings, and it's okay to not be okay sometimes. That's why all these services exist. So have them, but you know, get help if you can. Don't think less of yourself because you're having, you know, something going on with you. We all go through it. And I just want, go ahead, please.
I think that's something that they get from the military. I mean, I've been told by so many veterans that, you know, you don't want to be weak. You don't want to ever look weak. And that just carries over into their civilian life. And they look at that as a weakness. And mental health is not a weakness. It's a part of, you know, your journey in life, and we have to, you know, address it. And so, yeah, I feel like they do look at it as a weakness because of that training in the military. And so overcoming that is the first step, making them realize that asking for help is not a sign of weakness.
And I like to say too, like, trauma, depression, suicide ideations, it doesn't define your strength. And you were strong enough to survive it. Now you deserve to get the support to heal from it as well.
Yeah, and I'll add to that. It's not just you know, I don't want to appear weak. That is a big part of it, right? But I think there's also this expectation, especially with women veterans, that once they get out, they are they're caretakers in their family, again, not just for little ones, but sometimes for parents, or, you know, people look to women as caretakers being their primary role. So if you're supposed to have it together for other people, when do you get to feel your own feelings and navigate those, right? And so I think that's a big challenge. And so what I would say to a woman veteran experiencing that is just know that you're not alone. As isolating as the experience feels, it is very common, and that's why we're recommending get out there and maybe seek a group that you can meet other women veterans. And, you know, I'm a little bit joking, but a little bit not when I say, like, let's just be there and together and be crazy together, because sometimes it helps to know that, you know, this is a reaction that other people are having to the system and to the world right now. Jennifer's saying not all veterans are able to isolate. Again, this is my point that I said earlier, especially single mothers. 100% feel you on that one, Jennifer. We have a lot of women veterans struggling with high functioning depression and wearing a mask. Absolutely. Deborah, Bree, do you have any thoughts on that? I agree 100%.
Totally.
Jennifer.
I totally agree. And I feel like you're so right about that with women. We do carry that mask where we can just, you know, we're fine. And yet really we're struggling. And so, yeah, I definitely agree with you on that.
And I would just want to briefly bring up self-care. As a social worker, we always preach about self-care. I know it's hard for like single moms and whatever your situation may be, but even if it's like, oh, putting the baby to bed and I'm going to soak in the bathtub for 30 minutes, you also have to do that too, because you cannot pour from an empty cup. And if you're not taking care of yourself, then you're not going to be any good to your family members as well.
That sounds like what they say on the airplanes, right? Put your mask on first. I think we all need to do that in life. If you can't take care of yourself, then you can't take care of your family. That's essentially what you're saying, right, Bree?
Yes.
I really think that, the root of a lot of these issues with male veterans and female veterans could potentially be in the transition services that are not available. If you're able to, establish that peer support group or get yourself kind of set up to like, my life is going to be different when I get out of the military. So whether it's the State Department, the VA, someone, if you can get engaged with that and, kind of be set up, it eliminates some of the stressors, which stress leads to, depression. Look for those in your state. California has a huge, California Department of Veterans Affairs, a lot of states do. Just become engaged in something so it's not all of a sudden, I think Debbie said earlier, a veteran you knew was in for 16, 18 years or so, probably went in at 18 years old, got out at 34, and you had been told for 18 years when the chow hall is open, what uniform to wear. You get out, you are kind of still 18 because you didn't have to, pay your PG&E bill or pay, that stuff. Eliminating small things like that, small stressors, I think would help a lot. And obviously, there's MST and things that you're exposed to while you're in that are not related to that. Just trying to figure out where can you two guide veterans and female veterans to the importance of being properly prepared to transition out of the military.
And I will say I've understood that preparation for discharge is not as thorough, and it may be because the military person is so excited about discharging, maybe they don't pay attention to it all. But some of my coalitions were really working on getting a better packet ready for those folks that are discharging, so that when they go to their county, maybe they served in San Diego, but they're from Butte County. Discharging them there and not having resources isn't going to help. So we're trying to get a packet from each county. So when a military person retires, when they discharge, they'll have a packet with actual resources that are from the county that they are going to discharge to.
We're getting another comment from a viewer. Millie is saying, in many ethnic groups, the go-to is that there's no such thing as mental unwellness. Mental unwellness is considered taboo, and so that taboo still exists. And she's commenting on how unfortunate and sad that is. And I would, again, have to agree with that. You're a veteran, you might come from a family or a culture or a community that tells you that there is nothing wrong with you, and that if you believe there's something wrong with you, then you're just complaining and being dramatic. And that is unfortunately the message that is being sent to a lot of our veterans, and we need to overcome that and understand that in fact, reaching out and seeking help and going to therapy regularly, those are actions of strength, right? Those are, it's the same as going to the gym, right? You are a strong person when you do that. And so if you have any advice or perspective on that, Bree or Deborah, please feel free to let us know.
I'll say something.
Yeah, I just.
No, go ahead.
Go ahead.
Deborah. What you're saying, what you're talking about is, to me, Elena, is bravery. You were brave enough to join the military. You need to be brave enough to have those conversations with your family or with yourself that I need to take care of myself right now. I was able to make it through 4, 8, 10, 12, 16 years in the military. I can do this. So I think about that a lot, in my own personal life. I did this for 4 years. I can do this report that's due tomorrow. You realize what you've been through, and you can push through anything.
And I think people too need to realize like there's no physical health without mental health. So it's like one and the same. Like if you're not good mentally, then you're not good physically as well. So when you put that into perspective, it's like, you know, you go to the doctor for your annual visits and check up and do dentists and all these other things. You need to do the same for your mental health as well.
Absolutely. Really quick, one of our last questions, like if you can answer it in just 30 seconds. I'm a woman veteran. I'm watching this show. I'm seeing you on my television right now, and I'm feeling hopeless. You know, what is my first step?
I would say if she's ready to get help, then to call, or even if she doesn't feel like talking, you can text 988 as well and let them know how you're feeling, any symptoms, hopelessness, if you're having trouble being sleeping, all of those things of that sort. And you can text somebody even if you don't feel like verbally talking to them. So if you're ready to take that next step in reaching out for mental health services, then I think you should do that as well.
And honestly, 988 is the fastest way. I've had local folks say, well, can we have numbers of people in the clinic? And no, 988 is actually the fastest way to get a veteran connected to services that for crisis.
Thank you, and I'm so happy that we have so many women veterans commenting. This is, I'm just gonna say it, the 12th year of the show, and it's been the most comments that we've ever had, most live interactions. So women veterans, be very proud of yourself for commenting. We're here. I mean, you can go into your local county veteran service officer and just say, I need help. Most of us do not have mental health specialists in there, but a lot of us are veterans. We have a lot of women veterans. We'll get you connected, and most importantly, we care about you. Just come in and say, I need help, sit down. We'll get you connected in any county, in any state. If they don't do that, then you can call our office in Contra, Costa County, California, and we will do that for you. I'm very, very impressed. Thank you so much. Share it with the women veterans, share it with male veterans, share it with whoever you want to share it with. Family members, so important. This has been, an amazing conversation. We have about 45 seconds left, but I want to make sure we have a little bit of time for you all. Bree and Deborah, if there's anything else left to say, please.
I would say if your symptoms are worsening too, any emergency room, whether it's the VA or a regular civilian hospital, they also address mental health issues. They can assess you, and they can also provide a bed so you can get into inpatient too.
Thank you.
And there's also a lot of mobile mental health units these days, so they don't arrive with the fire and the lights going. So most counties do have mobile mental health that will approach the member in a very calm way and help get those services to them.
Well, thank you all again for joining us. That is our discussion. I want to thank all of our guests today. Please remember there is help available if you reach out for it. For veterans and those who love them, reaching out can make all the difference. We hope you have found our conversation educational. We leave you with some resources if you want to reach out. The Department of Veterans Affairs Women's Veterans Call Center is a good place to start. Call 855-829-6636 or go to va.gov to learn more about suicide prevention. Home Team for Veterans helps train veterans to have meaningful conversations about mental health. To learn more, go to hometeam.reflexai.com. The Veteran Crisis Line is available 24 hours a day. You can always talk with someone who understands. Just dial 988, then press 1, or go to veteranscrisisline.net. To rewatch tonight's episode, check back on our homepage later this week or check your cable provider's schedule for rebroadcast times. You can also rewatch this episode and many others on our YouTube channel, Veterans Voices of Contra Costa, so be sure to subscribe. Click on the link or scan the QR code to find us on all our social media channels. Our next show will air on Wednesday, August 13th at noon. We will examine another subject important to our veterans community. You won't want to miss it. To all of our veterans and their families, thank you for serving. To all who tuned in tonight, thanks for watching and have a great day.